Welcome back to Houston Life. When it comes to dental health, full arch implants can sound almost too good to be true. So what's real and what's just hype? We are joined by board-certified periodontist Dr. Michel Azer from the Texas Dental Implant Center. Thank you so much for joining us today. Coming back on the Houston Life set. It's really interesting. This ONEARCH, like a full, what is it exactly?
Yeah, it's a common question that we get a lot. Oftentimes we are presented with patients who have a lot of dental conditions, a lot of decay and periodontal disease, and they want one solution that addresses the whole mouth, and that's where we encourage them to seek the ONEARCH or the full arch restoration with implants. So it's a single unit restoration, exactly like it shows on the screen now. It's all connected together, it's in one piece, but that gives us a lot of control on how to design the teeth and also address the whole upper jaw at once. So there's no need for patchworking, and oftentimes patients choose it because it addresses cosmetics, addresses functions at the same time.
So who is someone that might need to get this?
So usually, and we find this a lot, it's parents who have been taking care of their kids throughout their life, and now they want to seek care for themselves because of years of not having enough time to address their dental needs. So this can be a one-stop where we can address everything all at once.
Wow. I mean, it sounds, like I said earlier, too good to be true, but it's a real thing. Yeah,
it's been a process that's been developing for years. It's not a magic pill. It's all based on science and technology. And we're standing now, it's actually the peak of performance of how materials are selected and the brand of implants and the science behind it. So it's really an excellent option.
Wow. How does it differ from maybe a regular implant?
It's different from a single implant because the way it's placed, by addressing the full arch all at once, we can find areas of bone that are not normally visible when we're doing a single tooth implant. So that makes the treatment time much shorter, meaning we don't have to wait for bone grafts to heal, which can extend the process to 1 year. A lot of the audience may have heard that one tooth implant can take up to a year, but how come does a full arch implant takes like a few weeks to finish? And the answer is we are unlocking a lot of areas of bone by removing the existing bad teeth. So that's how it is done.
Wow. I mean, is this better for someone who might have osteoporosis or something like that? Because I know my mum is she's got a lot of trouble with her teeth, and that's something that she has.
Yeah, I think the topic of today's show is to address the myth and realities of dental implants. The audience may have heard this all the time, that everyone is a candidate for dental implants. Yes, everyone is a candidate for dental implants, given that we follow the right protocols ahead of time. So someone who has osteoporosis, we have to communicate with their primary care physician and obtain some scans and records, and maybe put them on some bone supplements to help for the bone to heal well around these implants.
Wow. It's life-changing for a lot of people. And of course, we've seen a lot of before and afters, and everyone's smile. We can see the cosmetic improvement for people. Their smiles look amazing, but it's more than just a smile.
It is. I think a lot of our patients describe it as it's been life-changing. A lot of people do find more freedom worrying less about how they smile, how they talk, how people are going to perceive me. So it's more than just fixing teeth. I think it's just like a new way of living your life.
Do people, you change people's lives through their smile, and you get to witness that year in, year out when you see your patients having these vast improvements. Are people surprised? Do they think like, oh, look, I'd like to get rid of my bad teeth, but then do they realize there's just so much more benefit that comes with that?
I've seen it with a lot of patients who has started a new job. They started dating. They're on their weight loss and transformation journey afterwards, and it's all because they just feel more confident, more better about themselves after having nice teeth, which you show on every interaction daily.
Yeah, it's something that you take for granted
Right.
unless you need it. So, Dr. Michel Azer, thank you so much
Yes,
for
absolutely.
coming in today, walking us through what the ONEARCH is and how it might benefit people. It's always great to have you here
Thanks
at
for
Houston
having me.
Life. Thanks for being here. And of course, the Texas Dental Implant Center has a special offer for Houston Life viewers. If you're one of the first 20 callers, you will receive a complimentary consultation after a short pre-qualification call. The consultation includes a one-on-one chat with Dr. Azer, 3D scan and x-rays. This is worth $1,000. If you would like to schedule your appointment, then call 346-ONEARCH. That's 346-663-2724. Or you can learn more online at bestdentalimplantshouston.com, and you can scan that QR code that you see on the screen and see more patient transformations that way. We are going to be right back with more Houston Live.